Hi. Now we will discuss a very important system, which is the cardiovascular system. As you know, the cardiovascular system is composed of the heart and the blood vessels. The main purpose is to send blood into the lungs to get oxygenated and then deliver the oxygenated blood to the rest of the body. And this cycle continues on a repeat basis. So the blood which is deoxygenated in the tissues comes back to the lung and so on. So the heart is a pump. It has two upper chambers which are called the atria. They receive blood from the main chambers they receive from. So the blood vessels coming from the rest of the body, the vena cava, bring the blood into the right atrium, and then the two lower chambers, the ventricles, eject blood into the lungs and the rest of the body. We have a major artery called the aorta, which divides into the smaller arteries as it goes down to the rest of the body. There is a blood supply to the heart muscle itself called the coronary artery, and this is the first branch coming from the aorta. The pulmonary arteries take blood into the lungs, and this is where the gas exchange takes place. So the carbon dioxide leaves the blood and goes into the lung to be washed out, while the oxygen comes into the blood from the lungs. The oxygenated blood comes through the pulmonary veins into the left atrium, and then this goes to the left ventricle to be pumped to the rest of the body, the oxygenated blood. And as I said earlier, the veins bring the blood back to the heart, the inferior vena cava from the lower half of the body and the superior vena cava from the upper half of the body. These major veins are formed by confluence of the smaller veins from the origin of the limbs going upwards. The arteries end in arterioles, and we have the arterial end of the capillaries where the driving pressure pushes the blood through. There is the actual capillaries, and then the venous end of the capillaries join together to form the venules, which in turn become the veins. The actual tissue exchange of oxygen, glucose, and the return of metabolic waste and carbon dioxide happens at the capillary level. And as I explained in the earlier video on the blood and the lymphatics, some of the interstitial fluid that stays back at the capillary level gets returned to the venous system through the lymphatics. The renal system plays an important role in waste excretion. So the blood is pumped through the kidneys, the filtration happens at the glomerular filter, and then the exchange of materials takes place. So just like the lung exchanges oxygen, the liver removes toxins, the kidney has an important part in waste excretion. So the circulatory system takes the blood to all these areas. So just to recap what we already discussed, so we have the heart. Actually, they say the size of the heart is the same as your fist. So it's not very big, and it sits in the left side of the chest in this direction. And you have the apex, which is near the nipple line. This is the tip of the heart called the apex. The blue blood indicates right side of the heart is getting deoxygenated blood. So this is the superior vena cava, this is the inferior vena cava. Both enter the upper chamber on the right side called the right atrium. Then we have the tricuspid valve through which the blood enters the right ventricle. The right ventricle is a major pump on the right side. This pumps the deoxygenated blood into the pulmonary trunk. This takes the blood to the lungs, the right lung through the right pulmonary artery and the left lung through the left pulmonary artery. The pulmonary veins bring the blood back, which is oxygenated. So there are 4 pulmonary veins and they join the left atrium, which is the upper chamber on the left. So this is the oxygenated blood that comes back from the lungs. And once the pulmonary veins bring the blood to the left atrium, it enters the left ventricle through the mitral valve. And then this blood, which is oxygenated, get pumps through the aorta, and this pumping effect is called, this generates a systemic blood pressure. The blood vessel wall itself has an inherent elasticity, and that gives the diastolic blood pressure, which allows the circulation to be maintained even when the heart doesn't pump during the diastolic phase. So systole is the phase when the ventricles are actively contracting and pumping blood into the respective big vessels, and diastole is the phase when the ventricle is not pumping but the atria is bringing the blood into the ventricle to fill it. And the principle of Frank-Starling applies to the heart muscle, that when the chamber is stretched, the muscle reaches the optimum length stretch, the pump is more effective. So if the heart is underfilled, the pump efficacy is reduced. If the pump is overstretched or overfilled, like in a dilated heart condition, dilated muscle of the heart, then the pump doesn't work effectively. You may have heart failure from different reasons, most of them either on the right side, which is called the right heart failure. Suppose a patient has a lung disease which makes the blood vessels in the lungs very stiff. The right ventricle has to pump against pressure, so that's leading to right ventricular failure. And if the left ventricle fails, it can be because it has to either pump through a very high blood pressure in the aorta, or the pump itself is failing due to a muscle problem. So the muscle may be infarcted. You may have extraneous factors like pneumothorax collecting in the chest, which affects the blood pressure, and if the heart doesn't manage to pump effectively, then it fails. Remember that uh, left ventricular failure leads to congestion in the left atrium, and this congestion is transmitted through the pulmonary veins to the lung, and eventually a left heart failure of a severe degree will manifest in right heart failure as well. So the symptoms of the right and left heart failure will start overlapping. So this shows you what we discussed about what happens to the blood. So the arterial blood from the left ventricle goes to the aorta and comes down, and also to the cerebral circulation. The arterioles and then the capillaries, this is where the exchange happens, and once the oxygen is released, the deoxygenated blood comes through the veins into the right atrium, and the cycle repeats. So this blood goes to the lungs to get oxygenated. So the pulmonary arterial blood and then the pulmonary venous blood coming back to the left atrium. So this is just an illustration of the arteries leading to arterioles, leading to capillaries, venules, and so on. And this is just an illustration of how complex your vascular system is, how multiple vessels, venules, everything supply different organs, and it's very fascinating how the body works. I briefly mentioned that the blood pressure is a driving force to maintain blood in the circulation. So even during the diastole, when the ventricle is not pumping, the blood still has to go to the distal parts of the body. We can define hypertension as high blood pressure, which is related to the age of the individual and also the gender. The heart failure is when the pump is not working adequately. I briefly explained about how heart failure happens, how it is right heart failure and left heart failure. The heart failure generally manifests as lack of adequate oxygen to the tissue, so the patient may be breathless. You may feel the lack of oxygen, we call it dyspnea, and we may have congestion, so the lungs are congested. You may cough out blood-stained sputum, and we have the liver becoming enlarged because the right heart is not able to receive the blood adequately, so there is pooling of the venous blood in the liver. So we have a fast heart rate, we have low blood pressure, we have swelling in the distal parts of the body because the kidney doesn't get enough blood flow when the heart is not pumping well, so the water excretion is reduced. So heart failure can essentially affect multiple organs. There are a group of conditions called congenital heart disease, and this is related to malformation of the heart. So when the heart is forming, the structure doesn't happen perfectly, so we may have hole between chambers, and more seriously we may have abnormal vessel connections. We have cyanotic heart diseases, which are due to the right and left vessels not matching properly. There is mixture of the blood, so the oxygenated blood doesn't go fully oxygenated to the rest of the body. There are many conditions which cause this, and I'm not going into the detail, but remember that congenital heart disease may have cyanotic heart disease where the blue baby, and the acyanotic heart disease where there is excess flow happening but no oxygenation problem. And in the adults, we get coronary artery disease or ischemic heart disease. So this is related to narrowing of the blood vessels, that is the coronary arteries, which supply the heart muscle itself, and this is a process called atherosclerosis. So the lifestyle changes like increased fat intake, obesity, hypertension, and also a familial predisposition called hypercholesterolemia. Everything predisposes you to atherosclerosis, and additional habits like alcohol and smoking also increases the risk. If you have underlying diabetes, it increases your risk as well, and a family history predisposes you as well. So atherosclerosis causes narrowing of the blood vessel, and when the blood supply to the heart starts reducing, you first get a pain condition called angina when the exercise tolerance starts reducing, and you get a pain which radiates to the left side of the arm from the left chest. You may just get shoulder and arm pain as well. So, and sometimes the upper chest of the individual may be affected, so you may mix it up with gastritis or reflux. And so you should not ignore things, especially if the patient is feeling anxious. If there is excessive sweating, you may have a predisposition to angina. In some individuals, unfortunately, heart attack may happen directly when the blood supply to the coronary artery blocks. The muscle of the heart dies, which is called myocardial infarction. This is a life-threatening emergency. The heart often goes into a rhythm disturbance and the patient may die unless they are resuscitated immediately. So this is a few points about how you evaluate the heart function. So the X-ray chest may show congestion in the lungs. If there is heart failure, it may show enlargement of the heart muscle. Certain chambers of the heart enlargement, the muscle hypertrophy causes typical patterns on the X-ray. You have the measures of oxygenation like the saturation, and you have the blood pressure measurements. You can diagnose hypertension or hypotension. And you have the visual imaging of the heart called echocardiography, where this is ultrasound like imaging of the heart. It assesses both heart structure and function. It can assess the size of the valves and different aspects. We also have the electrical activity of the heart, which is studied by electrocardiogram. And just a simple thing that the heart rhythm originates in the right atrium in the sinus node on the wall of the right atrium, and this is conducted through the electrical conducting system, which makes sure these impulses are conducted quickly and uniformly to the whole of the heart, so the actual coordination of the chamber contraction happens. There can be disturbances in this conduction process, which is leading to arrhythmias. So this is echocardiography, where you see actually the structure, the four chambers of the heart is seen. This is an upside down inverted image. So you have the right atrium, right ventricle, left atrium and left ventricle, and these are the valves that on the left side you have the mitral valve, on the right side you have the tricuspid valve. We have the option on the machine to invert the image, you actually see it as you would see. And if you have the septums, this is the ventricular septum and the atrial septum. If you have a hole between them, you would see it as a red flow. So this is color Doppler, and according to the direction of the blood flow and the velocity, you can see it differently. And this is a different orientation of this is a parasternal long axis. So the ECG is recorded by leads placed on the chest or in the limbs, and this is the chest leads, and this is how the ECG looks like. You have the P wave, and you have the QRS complex, you have the ST segment and the next P wave. So you can count the heart rate and you can assess the heart rhythm. Abnormal beats will be picked up as well. So you should know that the ECG is an electrical activity record of the heart, and rhythm disturbances can be picked up on ECG. You also have blood tests which show elevated enzymes like the troponin or the CPK-MB. When the patient has a ischemia of the heart muscle, these enzymes may go up. So this is part of your test that you would do. So next we'll be discussing about the respiratory system. I hope this series of human body function is useful. It's fairly basic as I had explained, and please share it with your colleagues. Thank you.